Hi, it's Michael from Planet Naturopath. In this video today we're going to talk about cholesterol testing. In particular, the extensive cardiovascular test. This test will explain to you whether you have the right type of cholesterol or whether you have the small dense LDL cholesterol and high inflammation markers associated with cardiovascular risk. Statin medications are the most prescribed drug on the market today, but they're also way overprescribed. Just because you have high cholesterol doesn't mean that you need a statin medication. These drugs have a lot of side effects. So how do you know whether you have the high bad cholesterol or the good cholesterol? It's not just about HDL and LDL. You need to look at the inflammation markers and also the type of LDL you have, whether you have the small dense LDL particles or the big bright fluffy ones. I'm not sure if they're bright. Your body needs cholesterol. Every cell in the body has a phospholipid membrane. Hormones have cholesterol as the precursor. So you don't want to have too low cholesterol because that can have wide-ranging health effects. So let's have a look at a cardiovascular test and I'll explain what I mean. Here is an example of an extensive cardiovascular test. When you go to your doctor, they're only checking cholesterol, triglycerides, HDL and LDL. And while these markers are important, they're only a small part of the story. So in this particular case, the cholesterol levels are 5.5, triglycerides are 0.6, HDL 2, LDL 3.3. So this is quite a reasonable cholesterol test when you look at it from this angle. When we go into a little bit more detail, lipoprotein A is just a little bit elevated. I wouldn't be too concerned by that. Apolipoprotein B looks at the LDL particle size, which is important. And I like everyone to be below 1, so this is also a good result. Homocysteine should ideally be between 6 and 8. So 9 is slightly elevated. We actually look at methylation here. High sensitive C-reactive protein, ideally you want to be less than 1, so we address any causes of this higher inflammation marker. When we look at the LDL subfractions, we see down here the LDL3 and LDL4 are the very small dense LDL particles. Ideally LDL4 should be 0. So even though it's only 0.03, it's still 3 times the recommended amount. So we'll be looking at improving their LDL, not their total LDL levels, but their LDL particle size. This next example, once again, cholesterol is 5.2, which is quite good. Triglycerides are 1, which is okay. HDL is a little bit low, and 3.6 for LDL, I'm quite happy with that. It doesn't really tell us too much. We need to look into a little bit more detail. Once again, the apolipoprotein B is an important marker. That is a little bit elevated. But when you go down here, homocysteine, it should be between 5 and 7 or 8, and this is 16, so there's definitely a methylation issue. So high homocysteine is an inflammatory marker associated with cardiovascular disease, but also Alzheimer's. And then we look at HsCRP at 6.6. Ideally you want to be less than 1, so this is high inflammation here. The rest of the markers in the LDL subfractions are okay, so the main thing we're going to address here is homocysteine and inflammation. On this test, cholesterol is a little bit higher. Once again, it doesn't really tell us too much. We need to look into a little bit more detail. Lipoprotein A is elevated, and this is often to do with a genetic marker or genetic hypercholesterolemia. So there's a few things you can do about that, but the main thing you want to address is the underlying diet, nutrition. The inflammation markers are good, homocysteine, CRP, but some of the VLDL is a little bit high and the intermediate density lipoproteins are a little bit high. A lot of this could be addressed just with diet changes. And I don't mean going on a high-fat diet. We'd be looking at carbohydrate content. We'd be looking at vegetable oils, things like that. One last test. We've got cholesterol at 6.9. So this is when doctors would be strongly recommending a statin medication here. Triglycerides are 1, which is okay. HDL 2 is good. And the LDL is a little bit elevated. and the lipoprotein A is also elevated. But just to put that in perspective, I'll sometimes see people around the 1,000 mark. So 239 is definitely an increased risk of cardiovascular disease, but it's not a great concern. When we go down here, look at the HsCRP levels, 35. As I said before, they should be less than 1 or 2 at the most. So this would be the main thing I'd be trying to address here. There's more chance of a cardiovascular problem like heart attack, stroke with high CRP than high LDL. So the CRP is the inflammation that causes the cholesterol to cause problems with the arteries. So some of the other subfractions are a little bit high. The LDL1 and LDL2, these are the ones you want to have high. So they actually have high levels of good LDL cholesterol. So it's the inflammation we need to address here. Fibrinogen is an important marker. So when it's elevated, that can lead to thrombosis, more atherosclerosis. And with the report, you always get recommendations, both pharmaceutical and diet, lifestyle, and herbal and nutritional supplements to recommend. At Planet Naturopath, we'll give you the exact formula that you need to improve your cardiovascular results. So you can order a test through the website at Planet Naturopath or email tests@planetnaturopath.com and we can get a test kit sent out to you.